More and more U.S. state-level lawmakers are introducing a wave of new legislation to make America healthy again. This is after HHS Secretary RFK Jr. is pushing that. He said that he wanted to do this in his nomination hearings. Joining us now, the Chief Scientific Officer of the wellness company, Dr. Peter McCullough. Doctor, it's always a pleasure, and it's great to see you again. Thanks for spending time and taking the time to be with us. What's your reaction when you heard about this news? Because we're seeing states like Arizona, Kansas, Utah, they're now stopping junk food like candy and soda and from school lunches, and they're knocking that out of state government food aid programs. What do you think of this?
I think we're going to see changes even at the federal level. You know, the Supplemental Nutrition Assistance Program, as well as the Women and Infants and Children's programs, together, that's nearly $120 billion of our taxpayer dollars go for this. I think there's going to be a review and a prioritization of those dollars for high-quality sources of protein, fresh fruits and vegetables, and not paying for junk food to our most food-poor people in the United States. So there's a way to have the food manufacturers meet a higher grade and help RFK achieve his goal to make America healthy again.
Yeah, it seems like both sides of the aisle would support this. You know, the critics are asking, doctors have been saying, what is nutritious about a taxpayer-funded food stamp program meant to supplement nutrition when it's spent on junk food? Trump and RFK Jr. want to stop food stamps spent on junk food. Let's share the numbers. 23% of food stamp money annually is spent on junk food. Doctor, that's nearly $26 billion in food stamps going to junk food like potato chips, soda. Over a decade, that's $260 billion. $70 billion of that is spent on soda over the next decade. That's the estimate. That's a lot of money.
It is, and it's dollars wasted. In fact, it's dollars that's going to promote chronic disease like obesity, diabetes, and so many other health problems. So just like you can't buy alcohol with food stamps, you shouldn't be able to buy chips or junk food.
You know, Doctor, you have worked with the NIH, you've worked with HHS, you've worked with the government, you see how it operates. What do you make of the news that several thousand HHS workers, their probationary employees hired just a year ago, they were notified they're going to be let go? Is this an issue of the Trump White House letting go workers in government agencies? How do you see it?
You know, the government agencies, particularly HHS, ballooned over the COVID-19 pandemic. And over the past 5 years, the workers haven't returned to their offices. They've been doing it remotely. And I think it's time for a trimming, a house cleaning, and have our government agencies become far more lean and efficient. The administrative overhead does not make America healthier again.
Interesting. Doctor, do you agree with what RFK Jr. is saying about junk food and also vaccines?
I do. I think he's on the right track.
All right. Dr. Peter McCullough, that was a quick answer. We appreciate you. Thanks for joining us tonight.